My name is Mackenzie Murphy, and I chose to do my project on synovitis and the research into whether or not it can be cured. In order to understand synovitis, we must first understand the synovial fluids and how it flows through the body. So what is synovial fluid and what is it made of? Synovial fluid is a highly viscous, non-Newtonian fluid, and it is primarily made up of a hyaluronic protein complex, and it is commonly referred to as an ultrafiltrate blood plasma. The main components of the hyaluronic protein complex being protoglycans, lubricants, hyaluronans, and phospholipids. The primary purpose of this complex is for lubrication. The area of lubrication for synovial fluid is primarily for most joints within the body, and this fluid is found within joint cavities. While the text might be a little bit small, the figure on the right shows a synovial joint with a bone on top and a bone on the bottom. There is a gap present in between both of the bones, which are lined with arterial cartilage along the bone side, and then along the edge side where the skin would be associated to is lined with synovial membranes. The joint cavity, which is that space in between the membranes, is where the synovial fluid is present. For the purpose of this presentation, it is fairly important to remember where the synovial membrane is, as well as the area in which the synovial fluid is present. As we begin to look at the biomechanics of synovial fluid, we remember that it is highly viscous and a non-Newtonian fluid. This means that the motion of the fluid, due to its viscosity, varies drastically. It is also important to keep in mind that non-Newtonian fluids go through shear thinning, which means as the viscosity goes up, the shear rate is likely to decrease, and then vice versa. As the shear rate increases, the viscosity is likely to decrease. As abnormalities are presented in synovial fluid, it is important to keep in mind that painful health conditions may occur. And now that we understand synovial fluid and its biomechanics and where it can be found, we can now begin to look into synovitis, as well as some of the conditions that are similar or in relation to synovitis. Synovitis is a condition in the joints that is typically associated with some type of ailment, whether that be injury, disease, or an illness. It is the inflammatory response of the synovium, also known as the synovial membrane, during strain to a joint. This membrane is expected to thicken or swell up, and even bone erosion can occur. This happens because there is some type of damage, whether that be to the membrane or the fluid, that causes the synovial membrane to react in an inflammatory response to heal the membrane. The synovial fluid also thickens and decreases, and the clarity of it becomes less clear. This condition causes the joint to become highly stiff and even in some cases limit movement. Some common conditions that cause the synovitis to occur are things such as traumatic injury, gout, autoimmune diseases, infections, and the most important, which we will refer to many times throughout this presentation, is arthritis, specifically rheumatoid arthritis and osteoarthritis, which are the most common to be presented with synovitis. As of today, there is no current cure for synovitis or arthritis. There are, however, a handful of different therapeutic methods to help treat pain that is associated with synovitis and arthritis. But here we wanted to pose the question, is there a cure? So I've looked into a handful of research methods that promote the idea of reinstating the biomechanics of synovial joints in order to create a more fluid motion and reparative nature of the joint to prevent synovitis and arthritic conditions. There are a handful of current treatment methods that are used for synovitis, as well as common ailments like arthritis. The first one being ice, elevation, and compression, which is the most simplistic out of all of the treatment methods and is typically used for cases that tend to be mild or occasionally occurring up to frequently occurring situations. This treatment method is pretty straightforward. When your joint is inflamed, you ice and you elevate to try and reduce the inflammation, and then you compress the joint to try and compress the inflammation. Overall, this is meant to reduce inflammation in the joint in order to reduce a small amount of the pain that is associated to the synovitis or arthritis. This treatment frequently has to be done every few hours or so, or the swelling will likely come back. For mild cases, it is likely to go away within a day or so after icing, elevating, and compressing frequently. As cases get more moderate to severe, the use of oral drugs, injections, or even some procedures may be used. Anti-inflammatory drugs are the most common drug and are typically used mostly for just synovitis. Arthritic patients may use anti-inflammatory drugs, but it is typically to treat synovitis. These are typically used in a more moderate case, but can sometimes be used in company with other drugs for more severe cases. Disease-modifying anti-rheumatic drugs, or DMARDs, are used more commonly for severe cases. There are a large variety of these type of drugs, and you can see on the figure on the right, or the list on the right, I should say, that there are traditional and biological forms. While knowing all of these forms is not highly important, I added this to the slide primarily to show that there are multiple different kinds of DMARDs. In some forms of treatment, these can be used alongside anti-inflammatory drugs, in which the anti-inflammatory would be given first, and then the disease-modifying anti-rheumatic drug would be given on delay. These drugs also do not have a forever lasting effect. They last for a temporary period of time. Steroid injections, much like the oral anti-inflammatories, are used as an anti-inflammatory drug, although they are injected instead of taken orally. They are highly used in clinical practice and are more often used for pain relief and osteoarthritis. These are frequent injections for pain relief and proven to show short-term benefits. They can show pain relief for up to 3 to 4 weeks, although there's a lot of disagreement about the long-term benefits of this therapy method, as it is shown that the effects on synovitis have proven to be inconsistent from patient to patient. A synoviectomy is a procedure that is commonly done on major joints, where a large amount of the synovium is removed. This is often used as a last resort scenario for treatment methods. There are 4 main methods of a synoviectomy, 2 which are surgical and 2 which are not. The first one being chemical and radioactive, then open surgery, and then an arthroscopic surgery. Both of the surgical methods have been shown to actually reduce the bleeding synovitis, which is a chronic form of synovitis, although they are known to have limited mobility in the joints after the surgical procedures. This limitation in mobility is why they tend to be a last resort treatment compared to all of these other treatments listed. It is thought that prevention is better than having a cure, And perhaps that is said because a cure is so hard to achieve. And while people can be as safe as they want, prevention doesn't mean that everybody is going to avoid arthritis or synovitis. So what do we do for those people? Are they just out of luck? Or is there some type of positive outlook for chronic synovitis? As we look into research for cures of synovitis and arthritis, let's start by looking at tissue regeneration. Quite a handful of research has shown a relationship between stem cells and cartilage regeneration. The idea is that if we take different stem cells and expose them to growth factors, how will they differentiate to form separate tissues? The two main types of stem cells focused on for this application were bovine stem cells and synovial mesenchymal stem cells. A handful of research articles will be referred to throughout this presentation, and all of them start with stem cell digestion, in which they even all follow very similar methods. Starting out with taking a handful of samples, where collagenase will be focused on primarily for the purpose of this article. And then the samples will be put through flow centrometric analysis, and cells will be separated into different groups. You can see a figure representing this in section A at the very top of this article. It is found that synovial mesenchymal stem cells have a better ability to differentiate between tissues than bovine stem cells do. And for that reason, for the remainder of this article, we will focus primarily on synovial mesenchymal stem cells. Synovial mesenchymal stem cells have a great potential for regenerating cartilage, and for that reason, implantation methods are then further researched. Bioprinting is a method used while taking biocompatible materials and seeding them with stem cells in order to re-implant back into the body to promote growth. In this case, synovial mesenchymal stem cells are seeded into a hydrogel material alongside the growth factors that will promote the cartilage regeneration. This will then be called a bioink. On the diagram on the right, it shows the different characteristics and physical properties of this material. Although it is quite hard to see, there's a graph. This first one, A, is related to strain, and the graph C, over on the far right, is related to shear rate, and E and F, down at the bottom, are related to angular frequency. So while this all seems relatively straightforward, why don't we have a cure for arthritis and synovitis yet? What factors are causing complications? And what kind of challenges need to be overcome? Before we even dive in on synovitis' impact on cartilage regeneration, it would be good to explain why cartilage regeneration is even important in the first place. Synovitis and arthritis have what I would call an endless loop interaction. The rubbing nature and friction of arthritis causes the degradation of the synovial membrane and the harm to the synovial membrane, which causes synovitis. And because of that, synovitis comes hand in hand with arthritis. The theory behind it is that synovitis over time will continue to flame up, which causes the arthritic nature of the joint to constantly rub on the synovial membrane, degrading the membrane over time. If we were able to repair the membrane, that would allow for the body to continue to produce the biofluid mechanics of the synovial joints, continuing to produce synovial fluid as it properly would be produced in a normal joint, and preventing the need to constantly repeat continuous treatment methods and therapeutic methods. So if we know that cartilage regeneration is possible, then why haven't we done it in synovial joints? How does synovitis impact the cartilage regeneration? Well, if we remember, we are working with synovial mesenchymal stem cells. And stem cells' initial reaction is to reduce the inflammatory response present in the body. Because of that, as stem cells and growth factors are re-implemented back into the body, into arthritic patients, the stem cells' initial reaction will be redirected to fight the inflammatory response instead of turning themselves into cartilage tissue, thus completely distracting the target of the stem cells. I added in a figure down below that represents the demographic of a research project that was done. It breaks into two categories of rheumatoid arthritis and osteoarthritis, and a total of 13 patients were viewed between or an average age range of 62 years old. It also lets you know about the patients who are currently on some types of drugs versus some who are not. The reason I added this diagram was mostly to explain how no matter what type of arthritis was presented or medications that the person was currently on, the stem cells still reacted the same way, not dependent on any factors that were currently presented. Therefore, the only way that synovitis will not impact cartilage regeneration is to actually suppress synovitis, which means to pretty much take it out of the picture. Finding ways to prevent the synovitis from being present, such as reducing the inflammation, although with chronic cases it is not always that easy. This image shows a real-life example of what synovitis can look like in a human patient. The increased inflammation causes the skin to protrude, and as you can see in the wrist, could be very limiting to mobility. And as we've learned through this presentation, stem cell digestion is the base for most research articles that dive into stem cell research, whether that be with bovine or synovio-mesenchymal stem cells. We have looked at the extraction process and the sampling process and how they are separated into cells, as well as the comparison between different types of stem cells to see which stem cell has a better chance of differentiating different tissues. We have looked at implantation methods as well as the bioprinted method for implantation, alongside the reaction that happens from synovitis on the cartilage regeneration implants. As we've learned, synovitis has a negative response on cartilage regeneration, as it has prevented us from having a breakthrough in research in arthritic diseases. So what comes next for research? As we look into the future of research, the biggest hurdle comes from the suppression of synovitis. While anti-inflammatory drugs appear to not be enough to suppress the synovitis presented in arthritic patients for the cartilage regeneration, perhaps because the anti-inflammatory drugs do not suppress synovitis for a long enough period of time. If we could continue to advance treatment methods to provide a treatment that will suppress the synovitis in chronic patients for a long enough period of time, it will allow us to advance research in cartilage regeneration, as it will give more time for the cartilage buildup over time, as well as potentially restore the biomechanical nature of the fluid and the joint itself. So while I will currently say that there is still no cure for synovitis or arthritis, I suggest that it is likely not far down the road, as I believe that there will soon be a synovitis suppression treatment, and with that, there will soon be some form of research development into cartilage regeneration of synovial membranes. And for now, therapeutic methods still remain the most probable form of treatment for synovitis, as well as arthritis and common diseases. Thank you for watching my presentation. I hope you enjoyed it, and I hope that you learned something through the review of the research that I have covered throughout this article. At the end of this slide, I have added my citations, including citations for all of the figures and the articles that I covered throughout this research presentation. Thank you.